Hello again, everyone. In this video, I'm going to discuss a little bit about ending violence against women with the help of health professionals. Around the world, at least one woman in every three has been beaten, coerced into sex, or otherwise abused in her lifetime. Most often, the abuser is a member of her own family. Increasingly, gender-based violence is recognized as a major public health concern and a violation of human rights. The effects of violence can be devastating to a woman's reproductive health, as well as to other aspects of her physical and mental well-being. In addition to causing injury, violence increases women's long-term risk of a number of health problems, including chronic pain, physical disability, drug and alcohol abuse, and depression. Women with a history of physical or sexual abuse are also at an increased risk for unintended pregnancy, sexually transmitted infections, and adverse pregnancy outcomes. Yet victims of violence who seek care from health professionals often have needs that providers do not recognize, do not ask about, and do not know how to address. Health providers can help. Health providers can do much to help their clients who are victims of gender-based violence. Providers often miss opportunities to help by being unaware, indifferent, or judgmental. With training and support from healthcare systems, providers can do more to respond to the physical, emotional, and security needs of abused women and girls. First, healthcare providers can learn how to ask women about violence in ways that their clients find helpful. They can give women empathy and support. They can provide medical treatment, offer counseling, document injuries, and refer clients to legal assistance and support systems. For family planning and other reproductive health care, providers have a particular responsibility to help because 1. Abuse has a major, although little recognized, impact on a woman's reproductive health and sexual well-being. 2. Providers cannot do their jobs well unless they understand how violence and powerlessness affect women's reproductive health and decision-making ability. And 3. Reproductive health care providers are strategically placed to help identify victims of violence and connect them with other community support services. Providers can reassure women that violence is unacceptable and that no women deserve to be beaten, sexually abused, or made to suffer emotionally. Sometimes patients are reluctant to bring up this subject. They allow their current need to be at the front and center and possibly even think they are not worthy of the doctor's time in such of a matter. Any doctor can take the time and open up the door with simple questions. Here are a few samples a doctor can use to open that door. Before we discuss contraceptive choices, it might be good to know a bit more about your relationship with your partner. Because violence is common in women's lives, we have begun asking all clients about abuse. I don't know if this is a problem for you, but many of the women I see as clients are dealing with tensions at home. Some are too afraid or uncomfortable to bring it up themselves, so I've started asking it routinely. Asking indirectly is also a good approach. Some sample sentences. Your symptoms may be related to stress. Do you and your partner tend to fight a lot? Have you ever gotten hurt? Does your husband have any problems with alcohol, drugs, or gambling? How does it affect his behavior with you and your kids? When considering which method of contraceptive to use, an important factor is whether or not you can anticipate when you will be having sex. Are there times when your partner may force you unexpectedly? Does your partner ever want sex when you do not? What happens in that situation? And then, of course, the asking directly approach. As you may know, it's not uncommon these days for a person to have been emotionally, physically, or sexually abused at some time in their life. This can affect their health many years later. Has this happened to you? Sometimes when I see an injury like yours, it's because somebody hit them. Did that happen to you? Has anyone ever hit you or hurt you in a relationship? Has your partner ever forced you to have sex when you did not want to? Did you ever have any upsetting sexual experiences as a child? Are you in an abusive relationship? Can I help you with finding a way out? And then just a sample for histories that can be added to the paperwork or given to a client at each visit. Are you currently or have you ever been in a relationship where you were physically hurt, threatened, or made to feel afraid? Have you ever been raped or forced to engage in sexual activity against your will? And did you ever have any unwanted sexual experiences as a child? Many of these questions bring embarrassment, shame, guilt. It can open up the door to many feelings, but they need to be asked. So if you are a healthcare professional, and it does not matter what part of the profession you are, pediatrics, just general doctor, surgeon, RN, anything like that, it's okay to ask your clients. It's okay to know their history. It's okay to know if they are in a situation where you can help. And if you are just a client, or you want to go to a few of your local doctors and ask them if they have a form that domestic violence abuse sufferers can fill out, maybe encourage them to start asking. And if you are a victim of any type of abuse, it is okay to start the conversation with your doctor. They can help you in many different ways and not just with medicine. Don't accept a doctor to just, here's a pill, here's a Xanax, you'll get over it. Talk to your doctor. Ask them to help you locate resources that can give you a better future. It is okay to speak up and speak out. It is okay to question others.